Welcome back to the Morning Blend. Right now, employees all around the country have to choose a health care plan for next year. Joining us with some tips on ways to save money during open enrollment season is Chief Consumer Officer of UnitedHealthcare, Rebecca Madsen. Good morning to you, Rebecca. I understand Milwaukee's home for you, right?
Yes, my in-laws live in Milwaukee and my husband's whole family's out there.
Oh, that's wonderful. So we got to do a shout out to them, right?
Yep. Hi, Bob. Hi, Betty.
So cute. Hi, everybody in Rebecca's family. Okay, so let's talk about healthcare for 2020 a little bit. I always wonder what people should do with this period, what you should sort of do to prepare for open enrollment.
Yeah, open enrollment is the time in the fall when you can pick your benefits for the upcoming year. And we know that about a third of people spend less than an hour on the process. So making sure that you don't just check the box, and hopefully we can give you some tips today to make it a little bit easier for you.
Yeah, so do that for us. What are some of your best suggestions for picking the right plan for ourselves and our families?
So first, look at changes. Make sure you understand what's changed in the plan that's offered to you. Has your carrier changed? Have the providers in the network changed? So spend a little time understanding what your employer is offering to you this year. The second is look at the cost. Many people know what the premium is. That's the amount that comes out of your paycheck. But also look at the deductible. That's the amount you pay out of your pocket before your insurance kicks in. And then also look at the providers you've seen and the medications you and your family have taken, and make sure they're covered by the plan. A lot of people go out of network and get surprised at an unexpected cost. So make sure that you know what you've consumed in the past year, what your family's consumed, and make sure that it's covered by the plan that you're selecting.
Here at our corporation, UnitedHealthcare is our provider. So it's great talking to you. And one of the things I think about as we look at plans and we're trying to evaluate them is the trends, things that are changing, because there seems like more and more there are things to make it more convenient for us to access and understand our benefits, things like apps and medical care we can get even through the telephone, and different ways to have that information provided to us.
Yeah, well, first of all, thank you for being a UnitedHealthcare member. And you're exactly right. There's something now called telemedicine. And telemedicine is a great innovation between technology and healthcare, where you can see a provider through any of your preferred digital channels, your phone, your desktop, at the time that you choose. It often costs less than $50, so it's a great way to get care from a qualified medical professional and to do it on your time. Also, some other things to look at are things such as wellness programs. We know that about 70% of employers offer them now, and you can earn up to $784 on average from incentives by walking or doing other healthy behaviors, getting health coaching. So it's a great way to stay healthy and also to put money in your own pocket.
I love that. People are going to want to know where they can go for more information. I think so much of what we need to do is compare. When you're looking at a couple different options, it's really important to know things like the deductible and the premiums, as you mentioned, but a lot of other things too. So where do you suggest that people go for more tips and more information?
Yes, you're exactly right, is spending some time going through the process. We have a website called uhcopenenrollment.com. There's videos and tips and helpful information to hopefully make the process a little bit easier this year.
I forgot to ask you, too, how long open enrollment lasts.
So if you're an employer-based plan, it usually is about 6 weeks during the fall. It varies by employer, so make sure you ask your employer. If you have Medicare, Medicare goes from October 7th until December 1st, so making sure that you look during that time as well if you're a Medicare participant.
Great talking to you, Rebecca, and hello from Milwaukee.
Yes, hello, Milwaukee.
Great talking to you. Thank you so much for your time.
Of course, thanks for having me.
Absolutely. And there again is that website. It's uhc.com.